Okay, welcome back. Um, I know we had a terrific discussion. We'll now go through the three different groups, and each of the facilitators can provide some of the overall notes from the discussion. I know in our group we already had a lot of interest in keeping the groups together. There may actually be a broader list than even just your one breakout room that you'll want to connect with afterward, because we know everybody had to choose, but you probably had interest in multiple of the topic areas. So Lauren James will certainly help with setting up. We can set up a distribution list to let folks connect afterward. We can also send out a list of everyone who participated today in your institutional affiliations that you included when you registered, so that you that may help jog memories as well about the people that you had the opportunity to interact with. So let's start out. Holly, do you want to start out with notes from the group that you were facilitating? I think it was on contraception.
Yes, I would be happy to. And I just have to say thank you to the CTSA for putting this Blue Sky group together. It was so interesting and fascinating. We had such a wide range. We had nurses, nurse practitioners, physicians, economists, pharmacists. I'm sure I'm forgetting somebody, research coordinators, all working together to think about things, many of whom were parents of adolescents. So we also had this parent perspective in there. It was just awesome. So we talked about a bunch of issues because we had a wonderful pharmacist in our group who is Rebecca Stone. I just want to acknowledge that. We talked a lot about pharmacy-led interventions, specifically access to emergency contraception, which is allowed in all states and pharmacies, but also access to general contraception in pharmacies. So we talked a lot about that. And facilitators and barriers, and got into some policy issues there as well. We talked from a research perspective. Lindsay Bullinger, our economist, talked to us a lot about various data sets and limitations of data sets, and we brainstormed a little bit about how to actually look at reproductive health outcomes, sort of in big data sets, which is challenging, and so that was really interesting. We talked a lot about engaging parents in these discussions around sexual health and contraception. We talked about implementation science ideas around those various barriers and facilitators. And then we were having a great discussion about school-based health centers, how to work with them, how to study outcomes as we got called back into the main room. So thank you to my group. It was awesome.
Are there any questions from others for that topic area from those of you who were in one of the other breakout rooms, just that maybe were spurred by some of those topic discussions?
This is Megan McCool-Myers. I've had the chance to talk to Rebecca Stone before about her research on emergency contraceptives. Hi. And I was actually wondering if you know, or if you've seen any changes related to COVID in terms of emergency contraception, because people may have lost insurance, or that they just have had life changes that have prevented them from accessing, or they're afraid to go to their doctor because of COVID, what have you. But even anecdotally, have you heard anything that's changed in terms of emergency contraception?
I have not. Most of the people who are buying emergency contraception are buying it over the counter without a prescription, since Plan B went over the counter. So access to prescribers hasn't changed that much anecdotally. Ella, which is the prescription kind, isn't used as much anyway. And then also they're having a manufacturer shortage issue right now, so you can't get it anyway, regardless of COVID. So that's all I know. I don't have any other COVID specific data, but that's a great question.
Thanks.
Hi, everyone. I will add, at Georgia State University, we have just launched a program called #We Got You Covered GSU. It's a condom mailing request program, and so we have an actual website. I can put it in the group, so if it sparks any ideas, but it gives people us the opportunity to actually mail out, since COVID, students are not on campus as much, although we're still open, but they're not on campus. And so we don't want the process to stop. We know there are certain people who are still engaging in behaviors that require it or need it. And so we just launched that particular program.
I just have to echo that I saw some hand claps that I love that. We didn't even get into pandemic related challenges to access to contraception and other sexual health services. And so I love that you guys are doing mail order and like social media campaigns. That's awesome.
I wonder if there might be, even funding opportunities, COVID-related funding opportunities that others might be aware of in that area, actually, that could be very timely. And I know we've got some folks from CDC on as well, but any thoughts about that?
Well, I can't speak specifically about the funding opportunities, but I do know, which is kind of public information, that there are additional COVID-related funds that have been issued to state public health organizations, Georgia Department of Public Health, and the Department of Education. So those funds are available. I am not sure how the Department of Education is utilizing those funds, but the Georgia Department of Public Health, had some of those COVID-related funds, and there's information about that on the public health website.
I know there was a HRQ opportunity that was really early on that already passed around like telemedicine services. It was like a health services thing around maintaining access to essential services, which I think, many of us would feel that contraceptive services are an essential service. And unfortunately, it was sort of there and then it was gone before I could get my act together. I don't know if anybody applied to that or knows of other health services type research in this area. But I think the idea of both studying the effects of the pandemic and looking for COVID-specific funding from a variety of agencies is really important, because that clearly is, everybody's focus right now.
Mm-hmm.
All right, shall we move on to the PrEP and STI group with Dr. Camacho?
Sure. So we also had a great group with a variety of expertise. We had institutions. We had people from Morehouse, Georgia State, and Emory. We had OBGYNs, child abuse specialists, PTR people, researchers from Georgia State and Morehouse. And so we sort of talked about sort of in terms of the burning issues regarding adolescent health. We sort of focused our discussion more on the barriers that are happening in this area, and we sort of classify them in sort of like more of structural barriers, in which there's a lot of issues with sex education and access to service, knowledge of the teens about the services that they can get and the options that they have. School curriculums being very narrow, and maybe we sort of recognize that changing the curriculum is a huge problem and difficult to do, but something that maybe is a long-term could be worked on, but maybe trying other ways of making sure that the kids are getting the education that they need, either by peer approach, using technology, things like that. Also, how can we use the community to engage and facilitate some of those services for teenagers. We also talk about individual level barriers in which, access to care and STI testing and HIV testing is difficult. They're using the ERs for that purpose, and is that the main use of the ERs? Question that, and that there's, besides Grady and CHOA adolescent clinics, there doesn't seem to be an easy option for people to get access to some of those services, as well as increasing the STI testing sites that are specific for adolescents. So not only the health department that is very impersonal and not necessarily teen oriented, but how can we make services that are more specific for teens? And then we sort of had a discussion about parental involvement with, people advocating for, not having as much parental involvement, or maybe why not having parental involvement in a way that could also be conducive to better access to service, and getting to a point where the adolescent is comfortable with the parental involvement. And then also from the clinician barrier, a lot of education to not, there seems to be a good education in specific specialties, ID, adolescent, OB/GYN, but not necessarily as much in the general pediatric population that could help us increase the level of services to the teenagers. And then in terms of ideas of cross-institutional collaboration, I think we came up with a plan and an idea that in which how can we marry the institutions' strengths in both. It seems like the Morehouse folks are doing a lot in terms of education and technology, and they're interested in working in condom usage. And then myself at Emory, I'm doing sort of a study specifically in condoms of which is, the idea is to find which are the better condoms for adolescents. So distributing a bunch of different condoms for adolescents so they can try them and do sort of a peer ambassador training in which the peer ambassadors will go in and teach, or share their knowledge about the condoms they use to the other teenagers. So I work specifically in HIV, and the other folks were working in the general population. So how can we increase the number of or do sort of a similar intervention in non-HIV infected populations, so we can have sort of a more comprehensive study of condom or the types of condoms that people like or adolescents like. So that's sort of what the discussion that we had. So it was a very vibrant and useful discussion.
So again, we're open for anyone else to ask questions or about some of the topics that were raised in this group, as well as any other thoughts. Sounded like there might be, again, you mentioned resources that at Morehouse that have been used. Is that to educate more of the general pediatrics kind of provider population that might be expanded further, or opportunities for collaboration between the institutions?
Yeah, well, it seemed to me that they have access to a much, and Romo, please feel free to interject here. Their population is more of a general adolescent population, and I have more the HIV specific population. So how can we do projects that go across, not only for the HIV, I can help with the HIV population, they can help with the general adolescent population, as well as others at CHOA, and get a more comprehensive view of the projects that we, because a lot of the topics of HIV, PrEP, STIs can be tackled from both the HIV and the non-HIV infected population. So, so I think we have certain strengths in terms of the HIV population. They have strengths in the general pediatric population, so we can collaborate in that sense. I don't know, Rommel, if I translate that well.
Yeah, you did good. Yeah.
Andres, as you know, we've really struggled to get teens to come for PrEP. Is that something your group specifically had solutions for through some of these educational programs or others?
Yeah, not that we specifically had time to discuss that. I think that it's a great question. I think hopefully now that we've advertised it to a larger group of people, we kind of, part of what we did discuss is that a lot of the services are talked between teenagers by word of mouth, right? And so if all of you here in the call are able to take to your populations the message that Children's has a PrEP clinic, I think that will hopefully expand through the community, and then we can start accessing that service. And the more people we get, the more services we will be able to provide.
Is Pharmacist initiated PrEP an option in Georgia? I apologize for not knowing the answer to that.
Not that I know.
Our pharmacist is shaking.
I don't think so. Yeah, I don't think that's available yet. You know, it may be that in the future it moves there, but I don't think. The problem is, again, the parental situation, which is not clear yet how that, you know, it seems like it's possible, but there's really no, when you look at the law, it's still not changed, right? We just have this sort of opinion. But when you look at the CDC website, when you look at the Georgia law itself, it doesn't seem to have access without parental consent. So it becomes more tricky to do it like that. Seems like Rebecca had something to say about it.
I was just going to say, I think California is the only state right now that allows pharmacists to prescribe PrEP. There are a couple others working on it, but that's it.
So this might be a good segue to the policy discussion, and I will represent some of the summary, but again, for those that were engaged, we had also a really nice group, including program coordinators for programs both at Morehouse School of Medicine, Hugh Spalding, Assistant Dean of Students from Georgia State in the group, as well as Associate Professor from Morehouse School of Medicine and Prevention Research Center, a member from a nonprofit organization that focuses on school-based education, particularly with outreach to refugee populations, psychologist, assistant professor from Georgia State, and then two representatives from CDC as well in the group, and a nice opportunity to bring, again, all of these perspectives together. Some of the items that we talked about are, that adolescents who are different members of the group interact with talk about how they're just not being taught about sexual health in secondary education in elementary, middle, high school, and that they aren't even sure what are good sources for reliable information, and that the lack of information in schools or even at home from their parents is a real barrier. We talked about also that in addition to providing sexual education in Georgia, that this is typically a more conservative state, and that has been a barrier to even applying for funding from CDC that would include resources to provide more information about STI prevention. And even more forward-thinking, would be able to provide sex education that is also relevant for LGBTQI plus populations. And that there may be school districts that are more supportive, and that a kind of ground-up influence might be more effective in our state than a top-down approach. One of the other, comments related to that too is that talking about sex education that focuses on sexual consent may be more forward thinking than an abstinence only sex education program, which is often what's provided in the state of Georgia, as well as providing resources to help adolescents learn about sexual assault and bullying and ways to address these issues as well. There was a mention of greater resources to give youth voice for this issue, and that youth may be, one of the most effective voices to try to influence change. It was mentioned that some peer education programs can be highly effective, but that safe spaces need to be available for those discussions to occur. And that also led into some discussion of different, particularly social media platforms or text message based platforms that can allow a safe place for adolescents to ask questions and receive feedback, either from, a health education specialist. There have been some programs at CHOA that involve graduate students from the School of Public Health that seem to have been effective. And we also talked about a program from the Prevention Research Center at Morehouse School of Medicine that was looking at whether providing participants in the program strategies to develop their own social media messages might be effective compared to providing that messaging for them directly. And there they used Instagram. Also talked about, again, other platforms like TikTok is another strategy that's been used in giving support to adolescents to develop a content in a way on social media that's effective, and also uses kind of lay language in effective ways. And that program was looking at kind of, again, that concept of sexual consent and what that means, how to interpret signals or responses to know if someone is consenting to sexual activity or not. There was a mention also of making sure, again, things are culturally sensitive. A program that was mentioned talked about adapting messaging specifically in this case for persons from a Muslim background, and of course there'd be many other ways to make sure that programs are culturally sensitive. Let's see. Again, the text message based app was another program called Birds and Bees at CDC that allowed adolescents to text questions and receive answers from a health expert within 24 hours. So that's done in a way that's both, again, a safe space and confidential. Another app that was mentioned is the TMI app that allows questions for sexual health to be asked in a safe space. There was, again, discussion of ways to provide resources to teachers so that they have more topical guidance that's evidence-based, and that these types of resources should consider having a parent version available, because parents also need to be engaged in the types of education that their children are receiving, so they can help reinforce that and also be aware. And that sometimes there's challenges with that too, if you have a district where parents may not be as supportive, but that engaging with parents who are effective advocates can be really important as well. We had some discussion about including sports coaches as another school staff member that could be effective, and guidance counselors as well, particularly for K through 12, and that at the university level, that Title IX requirements provide a mandate basically for some of these types of educational resources, but having that in K through 12 is not as prevalent. Let's see, and then there was a mention that there in Georgia is no state requirement for school employees to receive background in sex education. However, HIV education is required, and so that's another platform potentially to help to talk about the types of resources that may be made available to teachers. In some of the cross-institutional collaborative projects that we talked about, it was mentioned that the Emory School Public Health Institute for Reproductive Health, their youth advisory group has just launched a survey to outreach to 14 to 19-year-olds in the Atlanta metro area. This will be done primarily through social media, but maybe that's another option to engage people from this group to help disseminate that survey. And Ebony Johnson, who's in our group, might have more info about that. And then also from Dre, I'm sorry, Dre, I don't have your last name written down, but from Georgia State, really couple of really interesting programs, again, happening there, and feel free to jump in and talk about them. But one is Men and Violence Prevention that advocates for strategies for men to prevent sexual violence, and they've actually advocated that additional education efforts occur earlier because there's so much influence that's already happened by the time that students are arriving on a college university campus. And then I will, the other program that we talked about was a program called EAAA, which stands for Enhanced Access Acknowledge Act Sexual Resistance Program. This is an Arnold Foundation grant funded program at Georgia State that is paused right now for COVID because it does involve in-person activities, but it focuses on college women and teaching them strategies to resist sexual assault, how to stay safe in the midst of culture change as we try to, bring everyone forward to avoid sexual assault. And then it also has a physical component as well to that. And it's actually a multi-institutional program being implemented across several states. And so is another innovative program that's occurring right now. And I will change some of that wording about Mazik videos, I think was another resource that was mentioned. Thank you for that as a way of giving teachers topical guidance on sexual health topics. So that's a summary, and happy to have others weigh in from the group.
Hi, so like Camille mentioned about the survey that I have, if anybody is interested in that, I know our information will be shared, so you can we can communicate, and I can forward that to you all, because the more help, the better.
And I see a comment about having a list of apps and programs, and perhaps, Lauren, we could include that also in kind of summary information that's sent out. I will say I jotted down names of them, but it might be helpful if you are aware of particular apps, if you could send that back to Lauren or put a link even in the chat, either way, but whatever's easiest for you, we'll try to include specific links or the right name, of course, for the program. All right, well, yeah, go ahead, Holly.
Well, I was just going to thank you again, you and Lauren, for convening this group, and thank everybody for participating. I think when we first talked about this in an actual conference room with each other so many moons ago, it's just really grown from there, and I suspect we've had wider participation, right, in this environment because people can Zoom in and not have to travel across town with our traffic, which is also better, but still. So I just wanted to say thank you to everybody for coming today. I look forward to following up with many of you.
And we'll, again, we can, let's see kind of where things go afterward, and I'll follow up, of course, with you, Holly and Andres, and if there are, certain folks that would like to meet again, we can certainly help facilitate that too. But we'll definitely send out additional information just based on today's discussion to help you connect as well.
I want to thank
All right, well, thanks so much. Absolutely. Have a good day. Stay